So, welcome, Luciano Ruggia, to the World Conference and to this conversation with Ash Scotland. Tell me more about your organisation and your work in tobacco.
Thank you. I'm the director of the Swiss Association for Tobacco Control. We are an NGO. We were founded in 1973, so we are over 50 years old. And we try to concentrate really on structural prevention and not behavioral prevention. What we believe is that really advocacy, changing the law, informing the population, changing the mentality. We have to transform the image that tobacco and nicotine consumption have in the society. This is important. We have to continue to denormalize tobacco and nicotine. They're not normal products to be consumed. So the role of my organization is really to try to foster that in Switzerland, and the member are several public health organizations, so we are really public health experts. On public health, I think we should speak about political health, because a decision that is taken in Parliament, a change in a law can have an incredible impact on the health of a population, especially on young people, kids. So we really strive to make advocacy with politicians, but also in the media, with key people in decision position, also in the administration, to foster that. And this role of NGO is fundamental in a country like ours. We need those organizations that really focus on tobacco and nicotine, because tobacco and nicotine is the major addiction of our society. In Switzerland, for instance, if we consider all the addiction, more than half of the social and health costs coming from addiction, they are coming from tobacco. So the addiction are also important: alcohol, games, and illegal drugs, but they don't cause so many costs on the society, on the health system, or loss of productivity, and so on. So we have to really consider that. Also, what is important is to observe how the market is changing. We have seen the arrival of those new products. Electronic nicotine, nicotine pouches, snus in Switzerland is legal, unfortunately, heated tobacco products, and so we have a diversity of products that is incredible today. And young people, they don't consume a single product. They consume multiple products depending on the moment of the day. So maybe at home they cannot smoke a cigarette because the parent will smell it, so they smoke an electronic cigarette, and then when they play games like football, hockey, and whatever, they use nicotine pouches, because they can continue to play without stopping for a cigarette break and so on. So you have more and more this multiple consumption. So now we are going toward an epidemic of nicotine, not just on tobacco. And what we see is really an increase of the prevalence of all products together. So we should not measure just the prevalence of cigarette, but we should measure the prevalence of all nicotine and products together. Is what we did in a recent research in Switzerland, and we see that young people between the age of 18 and 24, they consume, 44%, almost 45%, they consume at least one product of nicotine and tobacco, which is incredible. It's increasing. So this epidemic is not going away, it's not decreasing, it's increasing. But some products, we don't see them, like nicotine pouches are almost invisible. So we have really to continue to do our work and to change law to better protect the youth.
Thank you. And in Switzerland, you have a powerful tobacco industry presence pushing all of their range of products, don't you? Tell me more about what it's like working under that.
Absolutely. Switzerland, unfortunately, well, we're not a member of the European Union. We didn't ratify the Framework Convention on Tobacco Control yet, after more than 20 years. And we have this incredible, powerful lobby of the tobacco industry. We have the old seat of Philip Morris International. They have a huge research and production center in Neuchâtel. We have Japan Tobacco in Geneva, and they are extremely present and powerful in lobby, in parliament and so on. And they have a lot of money to do that. And we are tiny, tiny actors in comparison to what they can do. So this had a very powerful impact on the legislation. So we're really bad so far. We just have a law on tobacco products since October 2024. So until then, we didn't have a total ban of the sale of tobacco nicotine product to under 18 years old people, which is incredible. We were the last country in Europe not to have that. So you can measure the influence of the tobacco industry in that, because they stopped, they slowed down every possible measure that could improve the protection of the youth. So it's very difficult to work in Switzerland, and that's why organizations like ours are really important.
And are you finding it encouraging, as I am, coming from a similar organisation, to be at the World Conference? What's coming out of this for you?
The World Conference is a fantastic opportunity. First of all, it's in Dublin, which is a fantastic city. I love Dublin. It's really nice to be here again. But the conference is a good opportunity to exchange, to learn about the last development, new ideas, to confront experiences. So what is your experiences? How have you done certain things? Maybe I can take elements of that I can then apply in my country, to meet experts, professionals of public health that have the right knowledge. So this is a connection moment that is extremely important, is extremely valuable for us.
And is there anything you'd like to say about Switzerland that we haven't covered, or your work?
Switzerland is in the heart of Europe, so we're not disconnected from the rest of Europe, but we are really a bad example. And pressure should be done on Switzerland also from the European Union. Prices of cigarettes are extremely low compared to many other countries. Now I know that here a package of cigarettes is 17 euros, something like this. Taxation is a very important measure, and I'm pretty jealous of what you have achieved in Ireland or in the UK with taxation, because this is really powerful in stopping people to smoke, in encouraging people to stop to smoke, and so on. In Switzerland is less than half of that, but we have a standard of living which is much higher. So actually it's really affordable. When I'm looking at United Kingdom and Scotland and Ireland, we see very good examples, very good ideas, and we would like to be able to arrive where you are at the moment. So from a Switzerland point of view, I think that certain things that you have achieved here are extremely important, and I hope that you can continue really to fight tobacco and nicotine in this way in the future.
So Ash Scotland takes a precautionary approach to e-cigarettes because they are not available on medicinal prescription anywhere. They are recreational products, they have huge unknowns about long-term health impacts, and we feel that we should be recommending the things that are known and safe and effective and following the World Health Organization line. What's your view on these products?
I absolutely share your position. Electronic cigarettes and other nicotine products like nicotine pouches are not cessation product. A cessation product cannot be a product that is freely available to young people on a commercial market. First of all, we do not know the long-term impact of those products, and this, for me, is totally wrong to talk about harm reduction, as it has been co-opted by the tobacco industry. Harm reduction, when you look at the classical concept of harm reduction in the hard drugs like heroin, is not just about taking a substance for another. And in the case of nicotine, it's not that. We're not taking another substance for the bad substance. We are still going in nicotine, and sometimes in form of nicotine, like in electronic cigarettes that are even worse. Nicotine salts, or now we have the nicotine analogues. In classical drugs, you have harm reduction is a complex social intervention in order to support drug addicts, and sometimes it also includes giving methadone instead of heroin. But you don't buy methadone in the first shop in the street, and kids don't start to consume with methadone. So the way we're talking about harm reduction now or some people are talking about harm reduction in the field of nicotine is absolutely out of place. Those products should not be used to stop for harm reduction, and there's no a single product that has been authorized for that. Most of the electronic cigarettes come from China. They are produced in a very bad condition. They contain heavy metals. Sometimes you don't even know what is inside the product. So for me, it's a very dangerous discussion when we are speaking about harm reduction with those products. No, absolutely, we should stick to what the WHO is saying, because this is the right position and the right knowledge about those products.
And I think what the WHO is recommending is a package of measures that work together, the Empower framework. And I think you've talked about financial levers, so tax and price are really important, aren't they?
Absolutely. What I always say is that in order to fight tobacco, we need a range of structural measures. There's no one single measure that is good. We need higher taxation on products. We need a full ban on advertisement, including especially nowadays social media. We need plain packaging. I was walking last evening here in Dublin, and on the street, as always, you find packaging of different products and so on. I was shocked by the fact that for cigarettes you have plain packaging, but not for electronic cigarettes, which is totally absurd. Why you don't have neutral packaging for electronic cigarette? All products should be with neutral packaging. All products with nicotine and tobacco. And then you need auto measure, but it's the complex, the total measure together that really helps you to move in a direction of protecting the youth, avoiding the youth to enter the consumption, and also helping smokers to step out from the consumption of those very dangerous products, all of them.
Thank you very much, Luciano, for making time to speak with us and share your
Thank you.
experience.